Please welcome Representative Ryan Berman.
Good evening, everybody. I'm so happy to be here on the island with a room full of fellow grassroots activists. I'm very excited to be here and introducing our next panel on being all in on good COVID policy. Our moderator is Bob Norton, who's the Vice President and General Counsel of Hillsdale College. I've had the pleasure of working alongside him, well, actually via Zoom over this pandemic, on some election stuff. And in my time in the House over the past year, fighting against the administration, Governor Whitmer, unilateral control, her disastrous COVID policies that killed seniors in our nursing homes, standing up from, thank you, each and every one of you to push back against this administration and try to stem some of the damage that this administration has wreaked on our small businesses and economy. Where do we go from here? That's what we're going to find out from this panel as all in on good COVID policy. Thank you.
Welcome, everyone. Welcome to All In for Good COVID Policy. So this should be a very interesting panel. As you already heard in my day job, I am the Assistant General Counsel at Hillsdale College, and we've certainly had our challenges keeping a college open and running during this pandemic. In a previous life, I used to be Assistant General Counsel for Chrysler and for Mercedes. I was born in the Detroit area. I attended University of Michigan Law School. I've been involved in politics since I was 18 when the National Convention happened to come here to Detroit and nominated a guy named Ronald Reagan. So being 18 years old, I thought this is great. This is going to keep rolling forward. I should make sure, though, that I do point out we're all here in our personal capacity. We're affiliated in our normal daily life with other organizations, but we're not here to speak for them. In fact, we're lucky to have this panel that's willing to just give us their candid input. They're going to share information. We're just hoping this is going to spur dialogue with people and maybe help craft better policy. And of course, I have to make sure I give the disclaimer that none of this is meant to be medical personal advice for people. You should consult your own physician, maybe void where prohibited by law or whatever legal disclaimers that we should make. So let me go ahead. I want to introduce the panel because I want to make sure we can get into this as soon as possible. So we have Dr. Eric Larson here. He's a clinical assistant professor of anesthesiology at Michigan State University College of Human Medicine. He's also the host of a podcast, has kind of a cool name, The Paradox. So that is Paradocs. Did I get the plug in good there? Perfect. Okay, so podcast, The Paradox. He's served as the president of Kent County Medical Society, currently serves on the Michigan State Medical Society Executive Board. He's been practicing anesthesia in a private practice for 17 years in the Grand Rapids area. He received his BSE from University of Michigan in nuclear engineering. So he took kind of a light undergrad load and went to nuclear engineering. His MD is from University of Iowa. He completed his anesthesiology residency at the University of Iowa Hospitals and Clinics in Iowa City, Iowa. The Paradox podcast was launched in 2018, focuses on identifying problems in the U.S. healthcare system and people who found innovative and disruptive ways to deliver care despite regulatory hurdles inherent in the system. Since the beginning of the pandemic, he's interviewed a number of experts in medicine to get a better understanding of the virus and projected the course of the virus and the current trends in the pandemic. He says a notable interview for him was when he interviewed a Dr. David Graham, to give credit where credit's due, who authored a book. The book is From Killer to Common Cold, Herd Protection and the Transitional Phase of COVID-19. He has used the basis of the book as the foundation for understanding the progression of the virus. It was published in 2020, so we're promoting somebody else's book that has also been useful for Eric. The book's been accurate in almost all of its predictions. Eric's also the voice behind the version of the book that you would download in audio form. He's married, he has 3 children. One of them is a sophomore at U of M, one a sophomore at Western Michigan Aviation Academy, and one unfortunately was deceased in a car accident in 2018. That's a very, very sad story there. We also are happy to have with us Dr. Karen Nimchik. She's assistant professor in a Master of Public Health program and holds a Master of Health Science degree, very relevant to the topic we have here today. She's worked in higher education for 20 years, teaching in cell biology, human anatomy, physiology, pathophysiology, clinical programs, epidemiology, which of course is relevant. We were being told there were no conservative epidemiologists. She has such expertise, and she's also very knowledgeable on research methods. Her current interests lie in the public health of genomics and genomic education. She is chair of the Genomics Forum Policy Committee of the American Public Health Association. She serves on several groups in the National Human Genome Research Institute in the National Institute of Health, including this is a great title here, the Inter-Society Coordinating Committee for Practitioner Education in Genomics and Pharmacogenomics Group. Did I get that right?
You did.
So 2 very educated people who've got lots of good information. They've prepared for this. We had several calls to kind of think of what we could do. I know that they also consulted some other experts. There was one we had on the line from Spain, so they want to give you as accurate and relevant information as possible. And after thinking about it, we thought they want to jump right into the deep end of the pool. So you might have heard that President Biden has this executive order. The lawyer in me wants to say it's an unusual executive order because it's really an order ordering a governmental agency to come out with a rule. Let's just say it's a mandate. So there's this mandate that if you have 100 employees or more, they're going to need to be vaccinated. We haven't seen this rule yet, but of course, we've all heard the controversy, and I think we'd like to just jump right into that and get their thoughts on that. So who'd like to go first? Dr. Larson?
Sure. So I think when it comes to crafting policy for COVID-19, SARS-CoV-2 is the virus that causes this. It's important that we understand where we're going to go with this virus. What's the end point? And I think by now, most experts, when you hear them talk about things, that it is going to be endemic, which means this virus is going to be with us when we're all no longer here. It's going to continue on. So that means that there's no way to avoid this virus. That means that everybody on this planet is going to be infected with this virus multiple times. We know with other coronaviruses, with other respiratory viruses like adenovirus, rhinovirus, parainfluenza virus, those are viruses that cause the cold for most of us, that you get infected with this multiple times throughout your life. Different variants come and go throughout your community, and you get sick, and then you get over it. So you have two options right now. One is you can get the vaccine and get your initial immunity to the vaccine, or you can get immunity through an infection. But those are the only two options you have. You can't hide from this virus. It doesn't matter where you go in the world. It is going to be, again, endemic. And so when we come to craft policy, we have to understand one thing. We can't stop this virus from getting wherever it's going to go. It's going to go everywhere. It's going to become a part of our lives. And we have to just understand it, as long as we can't stop it, any sort of policy that's deemed to stop the virus and spread is going to be futile and it will be ineffective. And so most of our policies right now, most of our strategies, as you can tell, mandates, mask wearing, all these sorts of things, are usually with the endpoint of stopping transmission. We're now at the point where everyone can get vaccinated, they can get the initial protection with the immunity. So at this point, the question really, I guess, is what's the point of continuing on further avoidance of this virus that will find you soon?
So do we like the idea of if you have 100 employees or more, they must be vaccinated? I think Dr. Nimchek has some specific thoughts about this.
I do. First of all, having the policy, let me back up for a second. The most significant thing for any public health emergency, when you're talking about policy, the most significant thing is to remain calm and to gain the trust of the public. And I think that we have started out from the beginning losing the trust of the public based on many different things, such as inconsistent messaging and not untimely messaging, non-transparent messaging, and things like that. And so when we start to talk about getting this into the workplace, and probably some of you work at a place already where mandates have been put in place for you, either to be vaccinated or, well, masking for sure, but to be vaccinated for sure. And what it's doing is we have created a very separate and polarized nation. And we were already headed in this direction with all of the things that happened, dealing with the police and all of that before this. And once we added these policies in here, and now we're just continuing the rhetoric of dividing the nation. And if we're undivided, how are we ever going to get anywhere, for that matter? And what it's done now is it's made enemies of people who work together. Because the bottom line is always, are you vaccinated or are you not vaccinated? And there's no discussion about have you been infected or have you not been infected, because that side of the narrative is very much missing. And the narrative says, and I believe that Dr. Larson said this, you either are going to get the vaccine or you're going to get the virus probably several times in your life. But that's never brought up, and nobody believes it. If I talk to people all the time, no one talks about natural immunity because it's never been mentioned. I found it, in preparing for this, I looked through many articles and I found it mentioned in one. And it was in passing. So we've basically brought this down to the policy of be vaccinated or experience the wrath for someone who's not vaccinated.
All right, so we're trying to come up with good policy, come up with policy decisions. So I'll rephrase what you said to see if I have it right. So you're saying that rather than a policy that says be vaccinated or else, we should at least be taking into account the fact of if somebody can demonstrate they had the virus and has the antigen?
Yes, they have the antibodies. Natural immunity, there's so much research out there on natural immunity and the differences between those who've actually been infected with the virus and have recovered, obviously, and those who have been vaccinated. And the research that's coming out from other nations is really focusing on the fact that those who have natural immunity, those who have been vaccinated and have never had the virus have a much higher risk of actually contracting the Delta variant or just another infection. They also have a higher risk of hospitalization, and they also have, in some cases, even death over those who have not been vaccinated but actually have been infected with the virus. It just needs to be a part of it. We need two sides. We need to hear the whole story, not just half of it. If you give half of the story, I think that's called manipulation. And I think a lot of people, without knowing it, have been manipulated to just hear one narrative and not both.
So you're wanting to also take into account whether someone's had the disease, they can demonstrate that they have the antibodies.
Correct.
But does that mean then we like a policy? If you have 100 employees or more, they got to have one of the two? What about the people who say, I have none of the above and I still want to go to work, I don't want to lose my job?
I mean, I guess it comes back to the point that the fact that this is an endemic virus and that everyone is going to get it. If you understand that point, then everything else really doesn't make any sense, right? Because you're essentially vaccinating people, and obviously the vaccine, it prevents you from going to the hospital as frequently. It's a miracle that someone's going to win the Nobel Prize for this vaccine. That being said, once you can, even when you've been vaccinated, or if you've had a natural infection, you can get infected again. I've taken care of patients who've been infected multiple times. I've taken care of people who are vaccinated, been infected. We know that this is a common thing with these respiratory viruses. So even having a mandate to be vaccinated or not vaccinated is not providing the protection to people within your workforce. The protection for a vaccine is really it's really conferred to the person who gets vaccinated. It provides that initial protection so they don't have the actual run-in with the real virus the first time. They have some baseline immunity so they don't get quite as sick the second time and third time. But vaccinating itself is not going to significantly flatten the curve. It's not going to prevent transmissions. It'll probably slow it some, as we've seen in many countries. But you also see highly vaccinated countries are still transmitting this virus because that's just the nature of respiratory viruses. They're designed to get into your body. They usually stay in the upper respiratory tract, your nose, your sinuses, your mouth. They replicate, transfer to someone else, and that's what they do. That's all they're trying to do. They're not trying to hurt you or anything, right? That's just a virus. So I don't think that the mandates actually provide the protection people think it provides.
So we're not big on the mandate, at least in your opinion. You're not very big on the mandate at all. You think people should be allowed to make this decision on their own. So as a policy or as a public service announcement, the individuals that should really be seriously considering getting the vaccine?
Yeah, I mean, there are definitely people who should be getting the vaccine who should, you're going to get this virus at some point, and either after you've been infected or a vaccine. I'd rather, if I was someone at risk, so some of us are a little overweight, 38% of Americans have obesity is one of the
Now, you were looking at me when you said that. Was it?
We can just about look in a mirror most of the time, right? So, I mean, obesity and age. And so those are the two most obvious risk factors. There are obviously other ones, too, that usually go along with obesity, diabetes, hypertension. And so those are risk factors. And so you need to take that into account whether you should get vaccinated or not. And, I get the flu vaccine every year, not because I'm afraid of dying from the flu, but because I really don't want to get the flu. I'd rather have the flu and get sick for a couple days, which is what's happened, versus being out for a couple weeks. And so I think that's just how I look at it with this virus, with this vaccine as well.
Doctor, any comments? Did you?
I completely agree with everything that Dr. Larson has said. It's true, continuing to perpetuate or continuing the same narrative and just moving it now into the workplace specifically, it's just a continuation of what we've already seen. And again, looking around our country, I'm just not seeing other benefits from this. I heard a doctor speak, and the other narrative I think that's missing in this is, and for sure this was the case before we had the vaccine, when we said, we worried about someone else transmitting, like you transmitting to me or me transmitting to you. But the vaccine, what the doctor said was, this is a very personal decision with personal consequences. And we are still in the mindset that it is a personal decision. Well, no, not that it's even a personal decision, that it needs to be done because it has public consequences, but that's not true. And Dr. Larson has said this, that the vaccine protects, if I get vaccinated, it protects me. It doesn't protect you. There's no public consequences for it. And that's another thing that's missing. And again, before we had the vaccine, there were public consequences because we were all able to be infected and to transmit. But with the vaccine or with natural immunity, that's not the case anymore. And that's not being told either. And I just think we need, in the workplace, outside of the workplace, to start giving people all of the information that they need so that they will understand exactly what these decisions mean. And without making the people who do not want the vaccine be the bad guy.
So we've seen the vaccine age level coming down as to being approved for younger ages. What are your thoughts about continuing to roll that down to younger and younger ages? Now, you're pretty pro-vaccine. I mean, you're saying you get your flu vaccine every year. What do you think about continuing to roll this down to younger ages?
I mean, so I'm married to a pediatrician. She's very pro-vaccine. So we're a vaccine family. My children, so I have a 15, 19-year-old. They've both been vaccinated. I've been vaccinated. Again, you're going to face the vaccine. You're going to face the virus at some point. And so I'm always in favor of people having autonomy and making decisions on what they think is the best for them and for their children. And so I think it's reasonable for people to have the decision. Maybe if they have a kid who has a lot of problems, maybe it makes a lot more sense to have them vaccinated for their first encounter with to get immunity. But that's a decision, I think, between your physician and between you. And I don't know that anyone knows the right answer for lots of these things. I think in general, the vaccine's very safe. I think we've pretty well established that, but there are always risks for everything, so I don't know. I struggle with this, obviously, but again, I think, when if you were to mandate the vaccine to children, you're going to you're not protecting other kids significantly with transmission. So I think that's the key point. It's the hard thing for people to recognize is that viruses are all sorts of different viruses, right? We know HIV is totally different than the flu. And they transmit differently, they behave differently. And so likewise, vaccines for different sorts of viruses, they work differently, and they have different sort of endpoints. We know that if everyone gets vaccinated for polio, we pretty much eliminate polio from our environment. Well, clearly, if everyone gets vaccinated from SARS-CoV-2, it won't get eliminated from our environment. I mean, for one thing, 60% of deer in Michigan have had COVID, which I don't know how that's possible, but they have, and we've done studies. And mice have it, so it's everywhere. But that just goes to the point that it's a different type of virus, and so the goals for getting high levels of vaccination are not going to achieve the same things that they do for other viruses and other diseases that we worry about, like mumps and measles and things like that.
So we need to distinguish this from the idea of polio vaccines. You're saying polio was able to eradicate. That's not true for this type of virus in this situation?
Right.
That's an important point. So, Doctor, what about the continuing to roll it down to younger children?
Well, it's interesting because the United States is the only country that is pushing more so than the European Union countries, where they have come out and said that yes, children can obviously contract COVID, they can transmit it as well, but they, in all the research that they've done, they have stated that it's in just a minority of outbreaks as far as the children being involved. And so the question becomes, and most of the time they really don't get very sick, if they even have symptoms at all. And so the question then becomes, what is the benefit to the child for them to be vaccinated? And, Eric said people should have the right to choose for their children. That's true. That's absolutely true. But there are still the questions that need to be asked. What are the benefits and what are the point? And for us, I think it's interesting for the United States, the European version of our CDC are the ones that come out with all of the research on this, and our CDC and the American Academy of Pediatricians actually do not agree on this. So look, and this is new, and across the globe, we're all learning. So we do have some leeway. We need to cut everyone some slack in understanding things, but it just seems like there's a lot of research being done in other countries that I don't see being done here unless I'm missing them. And I don't know where they're at.
So we're not very in favor of mandates, and especially not mandating it for children. We're leaving that to parents to make the decision for their children on a case-by-case basis. Is that fair to say? Talk to me about bioethics and the idea of forcing, let's say, a vaccination on children because the old people, those of us heavy-set old people, as you were pointing out, but they'll protect us, so we should make all the kids get vaccinated. Good idea?
I mean, I think it's hard to argue that would be ever okay, right? That you're doing something. I think if that is your goal, if that's what you've decided to do, we should at least be honest and upfront that that's why we're doing it. I think to pretend that there is this raging epidemic of children who are dying from this disease, There are tragically some who do, but it's very rare, and the amount who get really sick is very rare. And so that's why when it comes to medicine, our first is first do no harm. And so you have to recognize the risks and benefits of whatever treatment plan you have. And if the benefits clearly outweigh the risks, that's certainly conveyed to the patient and they decide what to do, but it's a lot easier to recommend a treatment. And so I think, until we understand all the risks and benefits, I think it's hard. It's certainly with children. It is not as obvious as it is for someone who's 90 years old who has heart disease. That person clearly would benefit from the vaccine. It's just a harder decision as you get further down from people who we know are greatest at risk for making those recommendations.
So Dr. Nimchik, we're going to have children get vaccinated to protect the old people. What's your view on that?
No, until we see definitive evidence that children are transmitting and large outbreaks are occurring because they're all in school together and they're giving it to teachers and staff members at schools, that would be something different. But that's not what we're seeing, as far as I know. And there was one small study that talked about children who had transmitted. They went home, and the most likely people I think they said about 10% of kids who went home who actually were diagnosed with COVID, 10% of parents also were infected. 10%, they said most of them were recovered. Some required hospital stays, and again, that's going to be a case-by-case basis, but there just isn't the evidence to say that all children should be vaccinated at very young ages. I don't think.
What's the current? I believe in one of our conversations earlier, we had mentioned the CDC's policy as to vaccinating children for the indirect benefit. Do you remember that discussion that came up about that?
Yeah, I think the CDC has been sort of all over the place as far as its recommendations. It changes.
Yeah, I believe the situation is the CDC currently says that it is not ethical to vaccinate children for an indirect benefit. The only vaccinations children should be administered is for the direct benefit, and not because it might help the rest of us old people. So that's why we give them certain vaccinations, like for mumps and rubella and other things that help them, not just to keep the rest of us from getting sick. And especially because there's some concerns about the long-term effects of the vaccine. You seem to think those might be overblown, but there's some concerns. People are allowed to have that decision. They don't want people mandating their child to get this vaccine so other people might benefit, right? Let's talk about masks. We got to make sure that's part of our policy. First of all, I guess I want to just ask, what about Michigan? We obviously feel like we've had a lot more crackdown in Michigan. I think the nation's realized that. We've had some things that were pretty crazy, I think most of us feel, from not being able to go on motorboats or do some other things. But as we look at Michigan, can we make the argument that the tighter the crackdown, the less the spread?
You look at the numbers, and Michigan has sort of middling results. We're sort of average for COVID deaths per capita. So it's hard because there's so many confounding variables, right? Like, what's the age of your population? Comparing Florida to California, you've got an old state versus a very young state. You have the Midwest versus the West. We tend to be heavier versus the West.
Again with the obesity comments.
You got to be honest with ourselves, right? We're all family here, Michiganders. But so I think there's lots. It's hard to parse those out. Rural and urban, those all obviously make a difference, and sort of the timing when the virus tends to hit. But ultimately, it's hard to say obviously that one state did a lot better than another based on their policies.
So you're not seeing it doesn't jump off the page and you say, holy cow. Okay.
No, it's not obvious.
Well, that's disappointing, especially for the businesses that are out of business. It's disappointing to hear that, no real correlation. That's not great.
I put my boat in the water because my spring break was canceled in 2020, and then 2 days later, the governor said I was not allowed to get my boat. And I was the only one on the lake, and I was 20,000 feet from the nearest person. I thought I was pretty well socially distanced, but apparently, so.
All right, so I do want to stay in masks. I know we all love that subject, but let's talk about masks, and I guess let's go back to K-12. Masks for K-12, children in school. What are our feelings about that?
Again, I'm going to have to point to the European Union's CDC and the UK, Italy, and several other countries have said no to masks for children under the age of 12. And they just don't have the evidence to put that on them. And I'll pick on the CDC for just a minute because, well, I'm in public health and it's a public health federal organization, so I guess I feel like I have the right to do that. And they're again contradicting what the rest of the world is saying. And they're giving inconsistent messaging. They're giving, on masks again, they changed when the summer was coming around, they came up with guidelines for children going to summer camp. And they said that any child over the age of 2, and of course all adults, had to wear their masks at summer camp the entire time, indoors and outdoors, the only exception being if they were swimming, thank goodness, or eating, thank goodness. And actually, this is interesting because Dr. Fauci, in an interview after that, even stated that seemed a little strict and conservative. Those were his words. So I don't know where they're getting this. I don't know why they're pushing this mask mandate for very young children. And we've all heard the horror stories of little kids on airplanes. And the last one, he has asthma, and they get kicked off the plane because he doesn't want to keep his mask on because he's probably, scared of not being able to breathe. It makes no sense. It makes no sense whatsoever what's being pushed on us.
Dr. Larson, masks.
So, quickly, masks. If we can't stop transmission, even if it was to work, it would only slow transmission. We're all going to get infected at some point anyway. Everyone's had an opportunity to get vaccinated who wants to get vaccinated, so masks don't make a difference in that sense. The one randomized controlled trial that looks at masks, you look at Bangladesh, and they found that cloth masks made no difference whatsoever, and that's pretty much what everyone's wearing. So we've been basically wearing something that's completely ineffective by the one trial that we have that shows any sort of evidence. I think there's a cost to having masks, and by cost I mean you have to go to Old Navy and buy your mask. I see them from the hospital, but masks, there's some value to seeing people. There's a value to interact with human beings, and I think there's a level of anxiety or fear by seeing people in masks, and that there's a presence of a pandemic and just danger. And I don't know what that actually quantifies to, but I think it's a real thing. And I know, as someone you mentioned earlier, that my son passed away in 2018 in a car accident. And so my family was dealing with death and with grief. And I mean, I can only imagine what it was like for people who lost people last year, who weren't able to be together and to be with their family. And I know that it was hard for us everyone's talking about dying all the time. And so that is a real thing. And I don't know, I can't put my finger on to say exactly how much it costs. But it certainly damages society. And I think that we can't just do things to just do something. We have to have some sort of reason for it. And masking in general at this point doesn't make much sense.
So moving on to another hot topic, there's the notion of third shots, whether or not we should have it. FDA's gone a little back and forth. Talk to us about third shots. Dr. Nimchek?
I just read a study that came out. It's very recent, in September, just a week or so ago, actually. And it was from Israel. Israel actually has had some great research coming out of that country. And they're in a unique position because of the number of people they've had vaccinated and things like that. But they were proponents of the booster shot, if you will, the third shot. And they were coming out and saying that the research was showing that the people who were getting the shot, and they were elderly, mostly elderly individuals, those people had less risk of hospitalizations and reinfection and severe disease and things like that. And I'm not arguing with that. The thing that, and my husband hears me talk about this all the time because I teach research methods, and just anybody reading that article might say, "Oh my goodness, well this is great, and it is great if it's true." But the problem is, in research, there are a lot of other things that go into it that you have to account for. Meaning that every person walking around, and this was in the article, every person walking around in the street is not a clinical trial participant. They're just coming in because they said, oh, you need to have a third booster shot. And so the people come in and then they go home, and maybe those people go home and they stay there. And then what if someone else doesn't get the booster, but they are very active and they're out and they're with a lot of people? Well, that's giving two completely different scenarios that is giving us, that's leading or pointing to a result that might not be true because we're not accounting for behaviors and lifestyle and things like that. And those things have to be accounted for when we do research because they matter and they can give a completely different story. So people are pointing toward it. I guess I'm not opposed, but most of people in the FDA didn't approve it anyways. So, and as Dr. Larson said, we're all going to get it at some point. And if you've been vaccinated, a third dose of what you've already been given twice, I don't know what.
I see we're out of time, but I want to quickly give you a chance to give a comment on the third shot.
We need more evidence. I mean, I think that's, there wasn't the robust randomized control trials that we had with the previous vaccination schedule. We don't know the right dosing. We don't know the right timing. It's very common to have other vaccines where you have multiple doses. You have, 1 year out, maybe 2 years. And so we don't know those things. But we have to do it with actual trials. We can't just guess. And I think that's what we've been doing right now.
Perfect. Well, would you please join me in thanking our panel today?